we should hold these up too. Look at these cool handouts that we just got.
Okay, everybody look over here.
All right, well, and I will begin now, okay? So a few years ago, I was having brunch with a couple girlfriends at a restaurant, large table, bunch of us having mimosas, enjoying our day, right? Right next to us was a large group, also, but a family, kids, adults, that sort of thing, enjoying their day as well. All of a sudden, there was a scream for help in the group. A lady next to us was on the ground. Her family was shaking her, trying to wake her, arouse her. Nothing. The restaurant staff came in, 911 was called. The poor lady laid there, family panicking, shaking her, trying to wake her up, begging her basically to wake up. Finally, after what seemed like forever, the paramedics arrived. I remember them starting chest compressions. I don't know if she survived or not, but I couldn't help but think how no one helped. I don't think anyone could. And how helpless her family must have really felt, really. What I didn't know then, but I do know now, is that basic CPR could have helped her. Today, I would like to explain, 1, why it's critical to begin CPR even if you have no formal training. 2, teach you a simple technique that could possibly prevent brain damage and save someone's life. And 3, explain why you should teach these simple steps to your family members as well. By show of hands, how many of you have CPR training, formal CPR training? That's great. Fantastic. This is going to remind you how critical and how important those skills are. For those of you that are not, this is not a replacement for a formal CPR class. I definitely recommend that you take one if possible. However, what I'm about to teach you and explain to you will still help you save someone's life. When the heart stops, whether it's from a heart attack, a near drowning, or any other type of injury, the lack of oxygenated blood to the brain can cause brain damage within 3 minutes, and that person can die within 8 to 10. Now, considering that according to the National EMS Information System, the average ambulance response time in the United States is 9.4 minutes. This means there's really very little room to save somebody if their heart has stopped. And according to the American Heart Association and the Mayo Clinic, it's far better to do something than to do nothing at all. So if you're fearful that your knowledge isn't 100% complete, please remember that the difference between you doing something and you doing nothing can mean somebody's life. Here's the advice from the American Heart Association and the Red Cross. If you are not CPR trained, then what you should do is provide hands-on CPR, which is what is illustrated there in the handout. Whether you witness the collapse or not, always check your surroundings before you check the person. Then ask them, are they okay? Tap them, shake them. Look for rapid breathing. That's normal breathing. It could be fast, it could be slow, but it should be deep, as the way you would normally see somebody breathing. Gasps for air, like that, it's not normal breathing. If they're still unresponsive, call 911 and begin chest compressions. To give the chest compressions, as you see there, you're going to place one hand directly in the middle of the chest and place your other hand right over it and interlock your fingers on top of the other hand. Arms straight, shoulders should be directly above your hands. Keep your arms straight, like I said. Very important. Push hard and push fast. Compress the chest at least 2 inches. Now, while it may seem that 2 inches is deep and you can hurt somebody, the heart is deep inside of the chest cavity. And you're trying to pump the blood into circulation mainly to keep the brain from dying. Compress at least 100 times per minute and let the chest rise completely between each compression. Do this until help arrives or until spontaneous breathing occurs. Now, it's fantastic that you'll become familiar with this and what to do in this critical situation. However, the person needing help could be you. And remember in the story, the family members, they just stood there because they just really didn't know what to do. I'm sure that if they had been taught the simple steps, these simple skills, they would have felt confident in helping their loved one. Minutes before the paramedics arrived. This is why I encourage you to take the handout and the simple little lesson I just gave you and teach it to everyone in your household, the adults and the children. Remember, in conclusion, an ambulance takes almost 10 minutes to get to you, to help your loved one. And beginning effective chest compressions immediately can mean the difference between life and death. And you learning this skill and teaching it to people in your household can mean the difference of life and death for you. I hope this informative has been helpful and useful, and I want to thank all of you for your time. And you all have a wonderful, wonderful day. I really, really appreciate you guys this time. You know, I know how that